A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant development for adult social care in England, Health Secretary Wes Streeting has defended the ambitious yet lengthy timeline for reforming the sector, with crucial proposals on long-term funding not expected until 2028 at the earliest. Streeting has emphasized the need to finally grasp the nettle on social care reform, acknowledging that while the process is essential, it will require time and careful consideration. The independent commission, led by Baroness Louise Casey, is set to commence its work in April, but its final report will not be published until 2028. This delay has prompted criticism from various stakeholders, including Sarah Woolnow, the chief executive of the health think tank The King's Fund, who expressed concerns that the timeline feels excessively long and urged the government to implement immediate measures that could improve the situation sooner rather than later. Local councils and care providers have echoed these sentiments, arguing that waiting until 2028 for vital reforms is simply too long. The Commission's work will be divided into two phases, with the first phase expected to report by mid-2026, focusing on identifying critical issues and recommending medium-term improvements. However, Phase 2, which will address the organization and funding of care services for the future, will not conclude until 2028, a mere year before the next general election. Streeting outlined the government's ultimate goal of establishing a new national care service that can adequately meet the needs of older and disabled individuals into the 21st century. He dismissed suggestions that the government is delaying necessary reforms, insisting that significant actions have already been taken within the first 6 months of his tenure. Critics, however, remain skeptical. Woolnow reiterated that the government should take immediate action on various fronts, such as improving workforce conditions and quality of care, without waiting for the Commission's conclusions. Social care encompasses essential support for older or disabled individuals in everyday tasks, yet only those with the most complex health needs receive free care from the NHS. Most care is financed by local councils, leaving many individuals to bear the financial burden themselves, with some facing costs that could reach hundreds of thousands of pounds, potentially forcing them to sell their homes. Streeting has invited opposition parties to participate in the Commission's work, aiming to foster a cross-party consensus to ensure the National Care Service can withstand changes in government, similar to the NHS's resilience over the past 76 years. He highlighted a genuine desire among political factions to collaborate on this pressing issue. Baroness Casey, who has previously led impactful reviews, expressed her commitment to this critical task, which involves developing a plan for a national care service that meets the demands of an aging population while remaining financially sustainable. The care system has faced a crisis for years, struggling with rising demand, inadequate funding, and workforce shortages. Political consensus on funding reform has been elusive, with past proposals labeled as death taxes or dementia taxes and numerous commissions failing to effect change over the last quarter century. Despite the government's promise of a national care service in its manifesto, details remain scant. Streeting emphasized the need for national standards and equitable access to high-quality care across the country. The Independent Commission will engage with care users, families, staff, and the public to recommend the best strategies for building a robust care service that meets current and future needs. Concerns regarding the lengthy timeline were echoed by Melanie Williams, president of the Association of Directors of Adult Social Services, who argued that many potential reform options are already known and that delaying action could jeopardize individuals' health and well-being. Liberal Democrat leader Sir Ed Davey expressed bewilderment at the Commission's length and anticipated a more expedited process. Statistics reveal that approximately 835,000 people received publicly funded care in 2022, while Age UK estimates that around 2 million individuals in England have unmet care needs. The adult social care sector is currently grappling with a workforce crisis, with 131,000 vacancies among the 1.59 million workers in the field. The pressure on families providing unpaid care has intensified, with many facing overwhelming challenges. In response to the urgent needs of the sector, the government has allocated an additional £86 million to assist elderly and disabled individuals in remaining in their homes, building on previous funding initiatives. However, as the sector continues to struggle, the call for immediate and comprehensive reform grows louder. Stakeholders emphasize that without swift action, the social care system may reach a breaking point, leaving vulnerable populations without the support they desperately need. The pressing question remains: how long can the government afford to wait before implementing the necessary changes to safeguard the future of social care in England? That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.